And our next guest from the United Kingdom is Dr. Masoud Mohammadnezhad. Welcome. Yes, you switch with the arrows, and there's a pointer in the middle, the right one. And please, here's your microphone.
Sure. Hello, everybody. Good morning. Yeah, my name is Dr. Masoud Mohammadnezhad. I'm an associate professor at University of Bradford, close to the Leeds. And actually, I just moved last year to the UK. But before that, I was working for 7 years at Fiji National University. Majority of my research is about Pacific and Fiji. So one of the issues, I had a master student, Dr. Keeney. She was the head of Oxfam Clinic, which actually majority of women went there or going there to do cancer tests and so on. So she came to me and said, I'm interested to do research. I suggested her to do this research, which is about breast self-examination using health belief model. I will explain even about the health belief model, and you will know what is that model. So let me talk about the background of this study. So this, breast cancer is one of the most common cancer among women. And it is particularly among low middle income countries is very common. So female gender is one of the risk factor of getting cancer. However, male as well have chance to get breast cancer. So breast cancer can primary cause of cancer deaths among the women globally, which about 425,000 people in 2020 get died because of the cancer, and the number is increasing in future as well. So that figures as well shows the rate or the portion of breast cancer among different people, different communities, as well as the mortality rate. So it's estimated 1 in 4 women has breast cancer, which again the number is increasing, and the 5-year survival rate for the metastatic breast cancer is less than 30%. Means if you get breast cancer for the next 5 years, you have 30% chance to be alive. So that means you should be careful about your breast cancer. So you see in the picture different symptoms showed, which actually women should care about their breast health and be careful. But there are many risk factors for the breast cancer, such as being female. As I said, female have more chance to get cancer. Early menarche, late menopause, null parity and low parity, late age of mother's delivery, first baby, genetic, family history, age, using alcohol and consumption of alcohol, increased estrogen, and in the left side of women, they have more chance to get cancer than the right side. So Fiji is one of the small Pacific country, close to Australia and New Zealand. So in 2016, breast cancer was leading cause of cancer in Fiji women, and cervical cancer was second. About 41% of total cancer has been estimated among women in 2017 because of the breast cancer. And crowd incidence rate was in 2017 about 185 women get cancer. Fiji is very small country. 185 is big number in Fiji. And one study conducted in Fiji before this study found 85% of women already heard about breast cancer. 30 to 69 years old women had cancer at that age, and 2.6% were below the age of 30 years old. Means even you are younger than 30, you will have chance to get breast cancer. So there are breast self-examination is very safe, painless actually method to test yourself to see you have breast cancer or not. But there are other methods such as clinical breast examination, mammography, ultrasound, and MRI. So as I said, it is very safe method to test. And in public health, we believe if you do self-examination, definitely you can prevent cancer early age, which save the cost and your quality of life. So in Fiji, one study conducted before found 56% of women already heard about breast self-examination, and 43 already thought about that. Only 50% of them did this test. So means people don't try or don't practice breast self-examination. What is health belief model? You know, for changing behavior, we consider some factors will affect your behavior. How do you think about the disease? If you have chance to get the disease, you will scare and you will do preventive activities. Or what is perceived severity? If you get cancer and you know you will die soon, you will scare again, you do some activity to prevent that. What are the benefits of doing breast self-examination? What are the challenges or barriers of doing breast self-examination? And how much you are confident to do that, and what are the factors affecting to do something? If you have pain here, then you will think you should go and see doctor. Or if your family says, okay, one neighbor got cancer, you will think, okay, what is that? So you will be careful to go to the doctor to do tests. So there are some factors which affect people to do some action. So this is very good and important model in health promotion or public health. And we always do like this. So based on this model, we develop a conceptual framework. We found if we want to do breast self-examination, first people should have good knowledge and attitude about that. Then what are the elements of breast self-exam health belief model? And there are other factors which affect people to do some activities. So based on that, we develop our study aim and objectives. Overall, the aim was to understand what people or women think about their breast self-examination and what factor affect this practice. So based on the methodology, we did a cross-sectional studies, kind of methodological research approach, which we got women from 3 health centers in Fiji, in Suva, the big city in Fiji called Suva, like Prague in Czech. So women who actually were over 18 years from different ethnicity group and from Fiji citizen, and they attended at that 3 health center were invited to participate, but those who already had breast cancer or they were not willing to participate in the study, we said, you don't need to participate. We got about 400 women who came to those 3 centers to actually do some tests. And based on different numbers in these 3 health centers, we get about 400 to participate in our study. We used 3 questionnaires. The first questionnaire was about people's demographic characteristics. Second part was about their knowledge and attitude. And the third part, or the second questionnaire, was elements of health belief model. We wanted to see out of these 6 elements, which one predicts people's behavior. And we definitely tested that questionnaire because this questionnaire was used in other countries. So we did a pilot study to see this questionnaire is suitable for Fijian women or not. So we made this questionnaire a standard and we did some tests. We found this questionnaire is good for studying our study. So different scoring rate we used to measure the level of knowledge, the level of attitude, and the level of practice, as well as different levels of the element of health belief model. So definitely we used a statistical analysis, we test and use correlation test, regression analysis to see what are the predictor. And before that, we get ethic approval from the University Ethic Committee. We used information sheet, consent form to let people to know they want to voluntarily and participate in this research. So the results showed that majority of women who participated in our study were in the age of 21 to 30 years. Majority were originally from Fiji, but the second part were Indian Fijian. Most of them were married, about 54%, and most of them had 1 to 2 children. Majority, about 51%, were employer. They had high level of education. They were mostly Christian, 68%, and most of them were living in the urban. So the analysis of the level of knowledge showed that majority of women had moderate level of knowledge, not high level of knowledge. The result also showed that majority of women had monthly, or actually I can say based on this percentage, when we ask how often should be done, majority of mentioned about 68% said monthly. So they didn't think about doing more practice. And they should, who should do that? They were believe 47% or 188 people said individually I should do that. And we asked, do you do or do you test that one? 47% said yes. And if they said yes, we asked how many times. Majority said monthly we should do that. This is the element of health belief model. We ask many questions to see what is their susceptibility, what is their severity, perceived benefit, perceived barrier, cues to action, self-efficacy. That's 6 elements of health belief model. As you see, 67% said my chance to get breast cancer are great. So you see what they're susceptible about this issue. In terms of the severity, about 67% said if I had breast cancer, my whole life will be changed. So they found breast cancer is very serious. If they get, they will be suffered. In terms of the benefit, again, 78% said complication, monthly breast cancer is helpful for them. Again, they didn't get benefit of doing that. In terms of the perceived barrier, as well you see, they said, for example, doing breast cancer test takes time, or they said it will embarrassing me. So they didn't have good feeling good. They considered that one as a barrier for them to do that. In terms of self-efficacy, you see majority of them said I'm able to find the lump by performing BMC. BSE means they said we are confident to do that. And the last one, they mentioned, for example, about 89% maintaining good health is extremely important for them. So they wanted actually be more in terms of doing these tests. So this statistical analysis shows the correlation between different elements of health belief model and doing breast self-examination. So you see perceived susceptibility was one of the significant factors which affected their breast self-examination. Means if you be more sensitive about that, you are trying to do more breast self-examination. Perceived seriousness means if you think you will get the cancer again, you will have chance to do more practice. Perceived barrier was one of the significant factors which affected them to do breast self-examination. Means those who have more barrier, they didn't do less practice. Self-efficacy is another significant factor. Means when they were confident, they did more breast self-examination, and there was not a statistical significance based on the cues to action and breast self-examination. In terms of the demographic factor, we just did analyze based on correlation tests, and we identified the knowledge, age, and ethnicity, as well as the education and employment and also residential or status, means urban or rural, or factor affect people to do actually breast self-examination. And the last multi-regression analysis showed that perceived susceptibility, self-efficacy, ethnicity and also the knowledge were 4 factors affected Fijian women to do breast self-examination. This is the main result. In terms of discussion, as you saw, women had good level of knowledge, but in practice you saw they do less breast self-examination. So many studies, other countries showed that women usually have good knowledge, but there is no guarantee when you have good knowledge you will do breast self-examination. So what is the issue here? We should think about that. So level of knowledge in the study was even high. So same as other studies, maybe because majority women from urban and they had access to the social media and they had good knowledge. Level of knowledge in the study was higher than other countries such as Qatar and Vietnam. So Another study in Vietnam showed that the level of knowledge may due to the woman's occupation, education status, and the husband communication, they may affect people's behavior. Just
Doctor,
1 minute.
We have a question from the audience here, if I may.
I know. 1 minute, I will finish this one then.
Okay.
So let's talk about the recommendation. So definitely we should work with the women to increase their knowledge, encourage them to understand this is the main factor which affect their health, increase the mortality, as well as work with the NGOs and also ethnicity group to be involved in education, educating women to do breast self-examination. Thank you so much. I'm happy to answer the question.
Okay, very briefly, please. The question is, do women need a specialized training to learn how to test or examine themselves? What should I do when I want to learn this self-examination?
Yes. So, because as I mentioned in the introduction, this is very simplest way to do breast self-examination. So they don't need advanced training to know about breast self-examination. I believe in the health system, they should have some brochure or some education to people know how they can do. That's easy. And I show in the picture what symptoms shows which you are on the risk of getting cancer, or what is the symptom shows you have the risk of actually breast cancer. So you should do breast self-examination.
Thank you very much.
Thank you so much. Appreciate it.
Thank you, Doctor.